dispatched for a 72-year-old male patient whose history of shortness of breath and now is believed to have a decreased level of consciousness. Code 1 to 43 Belvedere Avenue. Arrive on scene. I say, hi, Matthew and Nick, or paramedics, you call it.
Hi, my friend here, he called me earlier tonight and last, I guess, around 2, and he said he wasn't feeling right.
Okay. I'll just get right back to you. So he called you tonight, didn't he? So we find a decreased level of consciousness. Sir, do you hear me? No response to verbal. We'll say unresponsive to painful stimuli. I'm going to come up and feel and see that we have a pulse. His skin color looks nice and pink. And I'm just going to have a look in his airway and see if we have any secretions. No, nothing in his airway as far as secretions. We can try to put some NPAs in it. I'm just going to look at rate and characteristic of breath. And we can try OPAs too. We'll try an OPA and see if he'll take that. Okay, you took the OPA. And rate, he's breathing 60 times a minute and shallow. We're going to bag him. I'm just going to grab the bag. We're working on some NPAs. You can get coffee.
No, I'm just rinsing this out. Is there stuff I have?
We're just recording. Okay, NPAs are in. I'm just going to put a bag valve mask on. See if we're hooked up to 15 liters per minute. Good chest rise and fall. Brittany, do you mind taking over bagging for me? I'm just going to do a quick physical assessment. So, pupils. They're reactive to light, about 3 millimeters. Trachea's midline. He's got obvious jugular vein distension. Just going to listen to his lungs. When you go ahead and breathe for him. Go ahead and breathe. Okay. Again. 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 Once more. Okay, and just breathe normal for him. I'm just going to listen to his heart sounds. He's got crackles through it. Okay, like his pulse is a little bit irregular and fast. Nice symmetrical chest rise and fall, no scars, rashes, or lesions. I will say that he's got a cardiac scar there in the middle of his chest, but good chest rise and fall. Abdomen a little bit distended, but seems soft. He's incontinent of urine. No scars, rashes, or lesions on his legs. Down to his ankles, we see that he's got lots of pedal edema. And his arms, no scars, rashes, or lesions. Feeling bilateral pulses, feel irregular but similar. Okay, so sorry, you're you were telling me that your friend, he called you over because he was feeling short of breath. Is that what happened?
Yeah, he lives next door to me. I just got a phone call in the middle of the night, and he was saying that he wasn't feeling right and that he wanted me to take him to the hospital.
Okay, and has this sort of thing happened to him before?
No, not to my knowledge. I mean, I've heard that he's had some problems with his breathing and his heart or something like that, but wasn't sure how severe it was. He wasn't really open about how he was with his medical history.
Okay, but he called you over tonight. What time did he call you saying he was short of breath? How long ago would that have been?
About 2 a.m.
2 a.m.? What time? And we'll say it's 2:30 now? Okay. Do you, did he say what was going on? He just said he was having a hard time breathing, or what did he say?
Well, yeah, he said something about like having a hard time breathing, not feeling right, and so I went to go grab all my stuff, like just to take him to the hospital, put on my jacket, went up to his door, but it was locked, and so I called you guys.
Okay, and the landlord just let you in, did he?
Yeah.
Okay. But he didn't tell you what he thought was going on or why he was having a hard time breathing, or. But
No.
does he have lung problems?
I don't know. He just said that he has trouble breathing or something.
Okay. Do you know if he takes any medications at all,
Uh,
or where he might keep those?
I think he keeps him back, like in his medicine cabinet, maybe. I'm not sure.
Okay, we got sats of 98% from the bag valve mask. Respiratory rate was 30. Blood pressure. And has he been sick lately? Is he, did you see him in the last few days?
Well, not really. I mean, he can kind of keep it to himself in the last couple of days, but not. We haven't talked since Monday.
Okay.
It was Monday.
Okay, we will say that our blood glucose came back at 6.2. So, if I understand correctly from the story you're telling me, while I've been trying to do too many things at the same time, is that he was called you over, said that he was short of breath. You came to got yourself ready, came over to get him. The door was locked, and then landlord let us in, and we came in to get him.
Yeah.
You don't think he's been sick in the last week, and you're not aware that he's had any episodes like this before.
Oh, I don't know. We don't want to talk about his
But he hasn't been in
medications.
hospital or anything in the last year or anything.
No, I don't think so.
Heart rate was 120, down to 32. And blood pressure is 178 on 92. Temp, does he seem warm at all? So it is a little bit warm. And you don't, do you any idea where he might keep his medications? His medications happen to be on the table in a little bubble pack. It says that he's got no known allergies and medications. He's on Lipitor, ASA, Nitro, Derm, spray, Ramipril, Celexa, and Ventolin Atrovent. And we don't know, because you don't know that he's ever had heart attacks or any, you don't really know any of his past medical history.
No.
No.
Our conversations stick to golf and what it used to be.
Okay. And last seen, well, he was talking to him, he was pretty short of breath about 30 minutes ago when you talked to him.
Yeah, he was like speaking almost like between breaths, I think.
Okay. Okay, well, he seems like he is in maybe, but we're done our incoherent medical assessment, so that's done. So when you're doing incoherent medical assessment, come in, level consciousness, ABC, you can stop things. Rapid physical assessment, followed by a set of vital signs, followed by OPQRST as best you can get, depending on people that are available and ample. And then when you're done that, it'll be time to look at your differential diagnosis and treatment plan.